this is one of the best centres for paediatric care within the country. We treat patients from all over the country and also Europe.
KIDS is operated by Birmingham Children's Hospital and provides a 24-hour-a-day advice and transport service for critically ill children in the West Midlands. The hospital also has some of the finest specialties in the world, including cardiac surgery, liver surgery, oncology, and a 31-bedded paediatric intensive care unit.
Parents and children come here because they know they're going to get a good service. There's a very genuine concern for the patients here, and I think that's very important. It comes across quite clear from all the staff.
Communication is critical to our department. We receive emergency referral calls from hospitals all over the region.
We use OpenScape Voice here, which is what we're transforming to from the old Realities system. So we've moved from TDN to SIP, an IP-based telephony. And as part of that, we're looking at things like web collaboration, Unify communication, because we can see these tools which potentially will make a difference to the organisation and the way that we can give our care to the patients. We do have quite a few mobile workers, and especially for community workers, where there is a potential where some very small diagnoses could be made using web collaboration.
Being able to access specialists on the move is critical for the KIDS department.
Rather than people having to go to different locations, all that can be controlled from the Unify product.
Birmingham Children's Hospital has used Unify for 15 years. Within the KIDS service, we originally used the AC Win system as our main communication hub, but recently we have just moved over to the OpenScape Xpert console system.
The integration with the existing systems was also key, and Xpert seemed to fit the purpose. It seemed to improve the process, it's reduced time potentially within the process.
For example, we are now able to give better care when a child is referred to the KIDS operations room. A typical sequence of events would be a child presents in the emergency department of a hospital in the West Midlands, and the doctors there identify that the child may need to be transferred to Birmingham Children's Hospital's intensive care unit. They will telephone the KIDS operations room. An operator will initially take some basic details and transfer the call over to a paediatric intensive care consultant who will be able to give immediate advice out to the doctor in that remote hospital.
Using Xpert seemed like a good way forward of not just improving the system, but potentially giving advancements in the future as well.
We believe that this is going to be a platform which will shape and expand as our service expands over the coming years.
They understood the needs of the organisation. They realised that we couldn't actually have any downtime as part of the system being transformed from one to another. They really cared and understood and listened.
They've taken time to come up to the hospital and to actually see what a typical day in our operation room looks like.
And really got to know the processes which we were going through as well to provide the service. Working with Unify was an excellent experience.